As we age, we are losing hormones. And hormones are communicators. I call menopause the mean old pause because so many people go into menopause and they're like, why me? They're frustrated, they're irritable. Estrogen is not just, a sex hormone. It's so much more than that. For a lot of women, if they allow estrogen to drop, it increases their risk factors for cardiovascular disease or things like dementia. I always ask clients, okay, do you want to walk or roll into later years? Because we got to decide now.
Welcome to Dr. Aimee podcast. So excited today. I'm thrilled to have a colleague of mine that is actually in Baton Rouge, but we're not together in the studio. And so we're doing this first time. So y'all be patient with us. I'm sure it's going to be great. This is Dr. Lynn, and she is with the Miracle Wellness Center. And she is amazing. So I'm so excited to hear and learn and pick all the things, pick her brain about all the smart things that we need to do. And we're talking about a subject that is so needed to be talked about. Because I feel like some people come to me with some issues, and so many women are coming to me and they're like, I have this, and I'm like, it's a hormone thing. And they're like, well, I tested my hormones and everything's great. So with all that said, we're talking about perimenopausal and menopause. And so that can be from, right? Am I right? Where sometimes people in their 30s can start and they can go to like your 60s and 70s.
That is right. Yes. I'm seeing it now in like mid 30s for some women, just depending on their situation. And that can be caused by external toxins. Also, emotions play a role in that if someone has been through a situation that has caused trauma in their life, because emotions are energy in motion, right? And so they're always flowing all over our bodies and communicating different things.
Wow. Okay. We're going to talk more about that because I like that. It's really interesting.
Yeah.
So we're going to walk through perimenopause, menopause, of course, because it's my podcast. We are going to talk about peptides, but you agree with peptides, love peptides too, and understand them. And so, the benefit of pairing this together. And so that's why we thought this would be such a good marriage, you and I, where we're like, oh my gosh, we should talk to people about this because we need to start with your clinic and we need to start with doing the hormones. I don't like to deal with hormones. I have enough of them myself. I don't want to deal with them. So, they can come to you, they can get some stuff. We're going to talk about how they can walk through those and then how this layers together, not to be a competition of you have to do either hormone therapy or peptide therapy. Ideally, in the world of a woman, adding both of these would be like an aha moment if you could. So that's what we want to give you is all of the options, all the ways to treat the symptoms that you're having. And then I want you also to kind of talk about the symptoms too, because sometimes we have these symptoms that we didn't even know were related to that. So I know you're going to blow our mind with all these things. So we'll start first to tell us about the clinic. Tell us about them.
So the Miracle Wellness Center, we actually won #1 medical practice here in Baton Rouge. Thank you. We're so happy to be able to say that because we really feel like we bring what is not there to Baton Rouge. So what wasn't there in the past. And so collectively, we are kind of like 3 providers in one. So I was trained in natural integrative medicine. So that full body approach, body, mind, spirit, emotions. Conventional medicine, I'm dually board certified as a nurse practitioner. So I have both board certifications for that, as well as a family nurse practitioner. I am holistic though, definitely more the holistic approach. So normally if I'm going to write a prescription, it's usually for bioidentical hormones, more so than anything else. If there's one thing, Dr. Aimee, that I can choose when people come to me and say, what is one thing for anti-aging? That is one of the things that I say, like hormones is a great way to start with that. And I know a lot of people too tag peptides with that too.
Okay. I know peptides for anti-aging, but hormones for anti-aging.
Yes.
Okay.
Yeah. So as we age, we are losing hormones. And hormones are communicators. So we always want to make sure that, we are on point with our hormones. The other box we come with is functional medicine. So getting down to the root cause. So what does that look like? It takes time. So we say we take an extra pause to get you to your symptoms root cause, right? So we always have our clients fill out information before. We want to hear their story. We want to know where they're coming from, what's worked, what hasn't worked. So that way, when we come to the visit, we are fully aware of their background. So we can truly listen to clients. And I feel like a lot of that is missing right now. And a lot of times we're seeing patients that have seen 5 different providers. They don't feel seen. They don't feel heard. They're frustrated. Some of my women are coming from OBGYNs that were not trained in hormones. And, I was so surprised myself years ago. I was sending out a hormone conference for bioidentical hormones, and I had an OBGYN sitting next to me. And as the speaker was speaking, she kept saying, oh my goodness, I didn't know that. I didn't know that. I didn't know that. So finally I turned to her and I said, well, what did you learn? And she said, well, I learned to deliver babies. And I was like, well, that makes sense to me. But I think a lot of women think that these people were also trained to do hormone therapy for perimenopause and menopause. And that's not usually the case. So statistics are saying 20% of OBGYNs are trained. So if you have 10 people that are OBGYN standing in a room, that's 2 out of 10, right? So not everybody collectively is trained in this. And so sometimes it's guessing. And so I just remind clients, don't guess, just test. Let's test it out. Let's see where we are. And not just the test by itself, but also like what's going on with your hormones. Like, is it sleep that we're having issues with? A lot of perimenopause, starts to creep in as far as, having issues sleeping. Maybe people can go to sleep. Some women, they go to sleep, but then they wake up between 1 and 3 or 1 and 4, and are challenged with that. For some, it's weight gain. It's like, where did this flat tire around my belly come from? Right. And I know you work with peptides with that too. So I call it the flat tire belly because it's like, where did this come from? But I just feel like this tube is around my waistline. So I see that a lot. And then I call menopause the mean old pause because so many people go into menopause and they're like, why me? I guess this is just when I get older, this is how I have to feel. This is how I have to look, this kind of thing. So I want to just encourage our listeners today, like you don't have to live small. Don't feel like this is something like a diagnosis that's going to limit you. You just have to know, hey, I'm in this new season. So there may be some things that I have to work towards to optimize my body. But the body was built to heal. That's how God made our bodies. So the whole idea is that we really want to support our clients from A to Z and meet them right where they are. A lot of clinics, they want, people to do this or that before they just meet them where they are. I had one colleague the other day that told me, she had a client that wanted to get pregnant and, they were doing some shift work and different things like that. And she didn't necessarily agree with that. And, I challenged her. I was like, you have to meet people where they are. A lot of times we have to, as women, we wear a lot of hats. And, for some women, they're providers in their family. Maybe shift work is their way of doing things. And so they need that. I know as a nurse, when I started out, I definitely had my fair share of shift work, and so we want to make sure whatever people are coming with, that we optimize right where they are with their lifestyle and something that they're going to be able to go home and do and not just talk about.
Yeah, I love all that. Love all that. You're going to hit back on the fact that doctors are not trained. So and it's a great thing that we trust our doctors. It's great, right? But in this new era, it's not just bring your little black bag and treat the things. Our life has changed. Our environment's changed. Our bodies have changed, men and women, although we're going to stay on women. Everything's changed. And there's so many other tools in the tool belt. And as a physician seeing a gazillion patients, you got to go learn about peptides. You got to go learn about hormones. And sometimes they're either not interested. They don't have the time. They don't have the energy. They would love to know. It's not that they don't want to know. As a physician, we want to know everything. We want to just learn everything if we can. But we only have so many hours in the day and you only have so much time to spend with your family and do your practice and treat your patients. And the medical model is a sick model right now. And it's unfortunate that it's just a sick model. It's come to me when you're sick and I can give you a prescription, which is definitely needed in certain situations. But if we want to be proactive with our health, and that's what I try to tell all my patients, even when I have my practice, and when they come to me with all these prescriptions and all the things, and even as a dentist, I was like, this is not right. Did you talk to this rheumatologist, talk to this endocrinologist? Like, who's talking to who? Is the heart doctor talking to the head doctor? Like, nothing's talking to each other. And so even though we have this great computer system and everything, and, all of our hospitals talk to each other, they do not. So I want people to hear me and hear you. And we say, like, you've got to go to somebody who can listen to you and find the problem. You can't just expect your OB to know it, your primary care. If you say, oh, I'm going to go talk to them, I'm like, okay, well, you can talk to them, but unfortunately, they're probably not going to know. And I hope they do. If they want us, you or I, to explain it. I'm like, come to us and let us explain it. We'll want better than you. We just happen to study it. That's all it is. We're not a better doctor or for sure not a better doctor. But, I do find that is a lot of the stuck that people get in. I don't know if it's an excuse that they're using just to be polite. I don't know if they're like, I want to go talk to my doctor because right now I don't want to deal with it. or I want to push it away, or you're going to be expensive. That's one too. You're going to be expensive because I can't use my insurance. Well, insurance wants to kill us. Sorry, I'm going to be point blank. Insurance doesn't care about their patients. They care about the bottom line, and they live in a big, tall building and they make $1 million. They're not caring about the patients like you and I are. And a lot of doctors are. I'm not for sure not bashing our doctors. They're amazing. But we do want people to know that there's other ways out there that they can go and get it tested. And there's ways that we will help them find a way to afford it and walk you through it. And like you said, meet you where you are. And we're not saying you're not going to go back to your primary care. You're not going to go back to your OB. We should all be working in unison as a team together to treat what needs to be treated and be respectful of each other. And so that's kind of where, and I love that you and I get to meet up and do the same thing because that's what it is. It's just people working together for the good of the patient holistically.
And I find that works the best for the patient. So if we are all cheering that client on and they're running their race, it's great because they're encouraged. They have support from every angle. I can't do it all, just like you can't do it all, Dr. Aimee. And it's like when you find somebody that's passionate about what they're doing, it's amazing for each client because they have a whole team of cheerleaders, like with the pom-poms, and they're like, run your race, do your thing. You got this. And I see so many results that are better when we do have a whole collective team working together. So I absolutely encourage each client to have that team. And I try to align myself with people who are passionate, who love what they do, who go the extra mile and are people of excellence, because you don't see that as often. And what you were saying earlier about the amount of patients that people are seeing now is between 32 and 42. I've talked to colleagues a day. I have one colleague I saw a few weeks ago that's seeing 100 patients in 3 days.
Wow.
Yes, it's crazy. So it's crazy to think about, like, from a provider's perspective, like, how do you cram that amount and remember what's going on with that many patients? And, you tend to see there's mess ups that are happening. People are making errors because there's so many patients in one day. But then with the patient's perspective, sitting in their shoes, like, what does that look like when you have a 7-minute visit and people keep looking at their watch or pulling up their computer screens or type? Okay, yeah, we can only talk about one problem because next I have to see the cattle call behind you. So I'm seeing clients that are truly frustrated with that space and they were wanting answers. They're frustrated that they haven't been answered after 5 different providers have seen them. They're frustrated that nobody can figure out the root cause and they're just piling on the medications. And for a lot of my clients, they're being given so many meds that each med has a different side effect. So I'm seeing patients for the first time, that are passing out as they're trying to, do their work and different things like that. Or they're feeling like, they're not 100%. The brain fog is just echoing in every aspect of their life. So I'm glad that we are here to support people through that, because unfortunately, we just don't have a system right now that is supporting them 100%.
You're right. And then I know we're going to talk about blood work, but I want to just touch on that while we're saying this. So a lot of people I hear, they go to the doctor, they go get their blood work, and the doctor says, your blood work is normal. You look great. Everything looks great. Well, we know normal is not normal. Like, they have this little cookie cutter. This is normal. And you and I both know we work on the non-normals that, it's not just if you're in this one little box, you're normal. We need to work outside of that box, right? And we can talk about that. We get to blood work, or you can talk about it.
We can talk about it now. It's fine. So I always talk about, we want an A+ in health, right? We don't want a C-, we want a D. Definitely don't want an S. So, a lot of times when we're looking at a conventional model, it's just the absence of being in the hospital, right? Is well. It's considered well or health, right? But really, I believe that health is the new wealth, right? And so we can have all the money in the world, but if we do not have a healthy body, a healthy mind, it's going to affect us every single day. And so I want my clients to have A+ in health so that it flows into every aspect of their lives. And the A also stands for abundance, right? And so we want abundance to just flow in and out of their life. We want them to be happy. We want them to be whole, healthy. And it doesn't need to just be like the absence of being in, a hospital or having, a procedure or anything like that. It needs to be more so every day they're living a life filled with joy, even though they might have ups and downs, but they have that peace and that joy that's flowing through their life. I mean, that's truly my desire for each client, because I feel like if you have that, no matter what life looks like with those waves coming in, you'll be able to stabilize and flow with the ups and downs.
I love that. I love that. We're both very faith-based too. So, Christians. And so it's like that joy of the Lord that you have in your heart, you want that to be able to shine through, and people have it, and they just, it's gotten like pushed down from all the other things. So we all have it. The light's there. We just have to let them open it up and let it show.
Yeah. Well, and even in the scripture, as we were talking about it, it says Jesus died for us to be whole and for the abundant life, right? So that's the equation. And a lot of people they think they stop at that Jesus died for our sins, but there's so much more to life than that.
Wow.
So I like to always remind people of like the equation via scripture that like supports that, that we're here to live the abundant life and not just, have just a humdum kind of a day every day. It needs to be like, hey, we're embracing this and we feel empowered to live our life and run our race.
I love that. Yeah. Because, we're only here for a short time and we don't know when our race is over. And so we want to be able to get to the end and say, well done, good and faithful servant. You did well. We did well with the vessel I gave you. You did well with the mind that I gave you. You did well getting disciples and treating people well with love. And so all of that is encompassed in what we do and what you do. So we love that. Okay. We got to get to the subject because I told you we could go rogue and we could talk about all
for sure.
Subject about this because I want to know. And I think most people don't understand all the hormones that are actually involved. When you say you're in perimenopause, menopause, it's not just estrogen, testosterone. There's some extra ones in there that, I was excited when I was doing some of the research on this too. I was like, oh, this is kind of considered in perimenopausal and menopausal. So why don't we go through maybe, and however you want to do it, but go through the hormones and tell us like why this hormone and what kind of like a little bit of what it does. So for somebody who doesn't have any idea.
So progesterone is usually the first hormone I start to see the drop in. And what I see with women, especially in perimenopause and menopause, because in perimenopause, our body makes the shift closer to fight or flight, just automatically. So progesterone is dropping. And so what we see when progesterone drops is instead of focus but calm, the opposite of focus but calm. So what has held us for our 20s and some of our 30s goes out the window. And what I normally see with clients is they're frustrated, they're irritable, maybe they're, jumping on family members a little bit quicker, whether it's their kids or their husbands. They're frustrated with work. For some women, that can mean they start to shift into like the hot flash mode as far as that goes. But progesterone has everything to do with GABA, which is a neurotransmitter. So if you don't have GABA, which is focus but calm, again, your body's going to be rocked in numerous ways. So it's going to affect sleep. It's also going to affect brain health. So that's huge. And studies have shown now they're recommending cyclical progesterone when we add progesterone on and not progesterone every single day. And cyclical progesterone is recommended and basically with the goal of decreasing risk factors to Alzheimer's and other cardiovascular events. So just like the body doesn't have amplified levels of things all the time, we always want to mimic what God has given us, the natural body. And so I always educate patients, the cyclical progesterone is really the best way to do that. And there's different methods. You can do topical, you can do vaginal, you can do oral. It really depends on what the client is suffering with at that time. And I would just say, if you're hearing this podcast, make sure that you touch base with your provider. None of this is specific to the individual. I work with each client very separate as far as that goes. So everybody has unique needs and not just testing, but also looking at your actual hormones as far as how are they moving through the system with your symptoms is important because it's important to know even if your labs quote unquote look good as far as conventional, it doesn't mean they are good, right? And so your body. And you have to know that it's your job to advocate and to find a provider that's going to advocate for you, right? And so just moving through that is important. Then you start to have, other issues sometimes even with like, fibroids and breast tissues that's changing and stuff like that. So we always want to go back to progesterone first to see kind of where we are with that. The other thing that plays into that is iodine too. I see a lot of people with low iodine that come in for things like hypothyroid and things like that. And so, you always want to make sure that you're looking at all that, because if we look across the board globally, it's very much low iodine is a major risk factor for thyroid issues. So when we're looking at like the big picture, I always kind of look at it as like, iodine is going to help us make sure that we can clear viruses and funguses a lot easier in the immune system, right? So it's important to have those things on board too, if we're really going to help our immune system through hormones, specifically the thyroid. And then we also have estrogen. So estrogen also starts to drop. So for a lot of women, if they allow estrogen to drop, it increases their risk factors for cardiovascular disease, for things like dementia, things like that. So estrogen is not just, a sex hormone. It's so much more than that. And people just kind of think of it that way. Also for vaginal dryness, there's 3 different types of estrogen, but we also have to look at, vaginal dryness is huge for perimenopausal and menopausal people, because all of a sudden intercourse becomes harder, right? And it becomes not as fun, not as much fun, because when you're having that friction and you don't have that lubrication, it's going to affect those relationships. And so we also want to make sure that we discuss that, because it's part of health, sexual health is absolutely part of health. So we make sure that we also talk about that during our visits too, to where we can make sure that's also a thriving aspect of life. And then what people don't realize about testosterone is that women need it.
Yes. And that would be, I was going to ask you this question too. Yeah. So now that you're on sex, is it testosterone, estrogen, or the fact that we need both of them to work in unison for the dryness and the libido and like even liking our husbands, right? We love them, but we don't even like you. That's that's all the things. That's the progesterone. That's all the hormones at some point.
Yeah. No, right? Absolutely. That's a great question. Yeah. So I would say both. We always want to basically go back to balance, like how the body was created. So testosterone can definitely help with libido. It also helps with muscle and things like that, especially as we want to work out. Perimenopause and menopause, we need to be working out. And I know, I'm sure, Dr. Aimee, you're going to be talking about that too with peptides. We want to make sure that we can be weight bearing, right? And that's not just for those nice looking muscles, but it's for prevention of like osteoporosis when we talk about like falls later in life. I always ask clients, okay, do you want to walk or roll into later years? Because we got to decide now, right? We do. We have to decide now. And at 40, we don't think of that as midlife. But if we look at the statistics as far as how long they're living now in the US, like it is, right? So 40 is kind of that midlife point where we need to check in with our bodies to see like, what are our goals? And if we're not matching those goals now, what can we do to, match those goals to live a long life and not have to deal with disability? Statistics say that women in the US outlive their husbands, but they're debilitated. So who wants to be debilitated? That's not a goal of mine, right?
Right.
So why not decide now? Decide that I'm going to walk and not roll. Decide that I'm going to have firm bones, that I'm going to have, a good physique going into our latter years. My muscles are going to be toned, those kind of things. And so I think it's just important to be able to embrace that. But also, testosterone is great for the brain. A lot of people don't realize that, it is very much a part of brain health for women. And so over time, you'll start to see that decline as far as that goes. And for men too. I know we're not talking about men today, but it's good to have good brain health.
Yeah, that's a big one for men, of course. That's one when we talk about when it comes to men.
Yes.
There's an estrogen issue also. We'll have to do a different podcast on the men.
Yeah, for sure.
We'll sure. Those little monsters later.
Yeah. And you had mentioned, like, do I like myself anymore? I think that's a great question too, because what we've seen in menopause is a big shift emotionally. Okay. And so there's that book called Let Them out there. So if anybody wants to like know a little bit more about some of those shifts that take place, I think she does a really great job as far as that goes. But, when we get to the second chapter in perimenopause and menopause, we have to ask ourselves, do we want to live the same way that we lived in chapter 1? Or do we want to do it differently in chapter 2? And so sometimes that's finding connections again with our spouse. Like okay, we kind of been hit or miss, or we've been like two ships in the night. Like, what can we do to have fun? You know? And that comes at different times. So if we still have, kids in the house, maybe that's finding a date night or something fun to do together, just kind of helping the relationship to continue to grow, continue to date, that kind of thing. So that it doesn't get boring. And also that, everybody's needs are served basically, because I feel like women carry the brunt of the needs for the family. And, a lot of women are working. And so at the end of the day, it could just be that I'm tired, right? And that's fair, And so we have to, know how to like tag team life when we have a significant other to come together and figure out what that looks like. And a lot of times it's sharing responsibilities as well.
And so how do you feel about cortisol and the thyroid? You mentioned the thyroid a little bit. So are those two both tested? And then how are they related in the perimenopause menopause?
Okay. So cortisol is huge, nonstop. So a lot of times people don't realize that cortisol can also be related to kind of our rhythm every single day. So I always tell clients, like, go outside, look at that sunlight when you get up in the morning, spend a few minutes outside. A lot of people don't know our retina actually has a way of seeing blue light come into the body. And so it literally helps wake us up in the morning, gets our cortisol going, which it should be high in the morning. I had a client ask me yesterday, Dr. Lynn, I thought it wasn't supposed to be so high. I'm like, no, that fasting cortisol in the morning is supposed to be high. That is that battery. We want it raring to go in the morning. We want it up. We want it active. In the middle of the day, that cortisol should drop to about halfway. And then at night, we want it to really, really drop. We want that plane to land. Now, what I do see in a lot of busy women is that it's taken off at night because, she's gone through all the checklists from work, from home, from all the things, social life. And so I really encourage women, write that stuff down, like be able to write that stuff down so that you don't have to be going through and cycling through those things at night. I think that's huge to really realize. So cortisol is huge. It's a foundation to all of our hormones. So if you have like a hormone pyramid, cortisol would be the foundation. So that's that first floor, and so if we're going to like really build upon that, we got to make sure our stress levels are good, because the next step after that is insulin. So then we don't want cortisol tapping on insulin's door going, hey, you need to go up because I'm so stressed out. I'm in fight or flight. So my body's looking for food. It's, it's looking to help me to get out of this, And so I think it's important to know that. And then thyroid too, I see a lot of thyroid imbalance, again, in perimenopause and menopause. So I think it's important to know that there's other options out there that don't just include things like Synthroid, that are a little bit more bioavailable to the body. And so not to say that nobody can have Synthroid, but it's not for everybody. Okay. And so everybody's unique. And so we also try to really meet people where they are as far as that goes. We also are looking at that iodine level. And also we can do some of this through food. So we talk through that. So most of your, professionals out there are not trained in nutrition as far as the medical field, but we are. And so we really talk people through like what you can do at home to help these levels like iodine, overall to help your health. And underlying issues with gut health affect everything with hormones, which most people don't really understand. And so I had a client that, she wanted to start, her hormones, but she hadn't had her gut checked yet. Well, she started having some challenges because, her gut health wasn't on point yet. So sometimes I run a specific functional medicine test where we can start to see that estrogen is recycling. So if nothing else, I want our clients to remember that if you had a soda bottle and it said recycle on it, and if it was labeled estrogen, you would definitely want to throw it out. That's nothing you want to recycle, right? We use it once, it goes through the system, and we're done. Because when it recycles, that's when we have issues like histamine reactions that are happening and different things like that. So sometimes we have to be careful with that because of the fact that, it just flares other things. So it's all about balance. It's not just hormones as a silo and it's by itself and, nothing else can affect it. It's looking at the whole body as far as the approach, which is huge. And then Dr. Aimee, do you have peptides that you would recommend for specific gut health if people are having challenges with that?
Yeah, absolutely. Yeah, and that's mostly inflammation, right? I was going to talk to you about that. So a lot of people come to me and they're like, where's this tire? Like you talked about the flat tire. Where's this coming from? And where's this coming from? I actually had a patient yesterday, a client that I met, and she's like, I just need to talk to you about this. And she's seen all the doctors. She's seen her blood work. Blood work is all normal. And poor baby, she showed me pictures. I'm at 220. I want to be, this is me at 180, shows the pictures, and the picture's so different. But it's like no inflammation, all things. And she's stressed. And like you talked about earlier, she had some trauma in a past marriage. And so I'm like, and she's a Christian too. So I'm like, come on, girl, we're going to have to work some of this out. So it's really going from at the very bottom of things and then trying to layer it all on. But we all want a quick fix. Everybody wants, we all do. We want to like do an injection and be done. Right. Everybody wants like right now or yesterday. And I get it because I'm a right now or yesterday person too. But when you look at the big picture, it didn't take you right now to get there. It took you all these years to get into this situation. So it could take you all these years to get back around. Hopefully not. But with layering, like you're talking about, like helping food, helping nutrition, using the hormones, making sure your hormones are right, and then adding on peptides. If you can put all your tools in the tool belt when you go to work and you just go to live, you're living abundantly, like you talked about. Like you're living full, you're living abundantly, you're living standing, not rolling. All those things work together. But I do find like when she was telling me all the things, it's just almost everybody that comes to me that's frustrated with they've had a GLP-1 and it doesn't work, or I've tried this and it doesn't work, or I did it worked and now it's coming back. It's all for me based on cortisol. And so, and now that I'm learning with you, I'm probably missing some hormone pieces in there when I talk to them because it's all the same age group women too. It's all that same spot where they just throw progesterone at them. Well, that's great. You're going to sleep a little bit better, but are you sleeping restored? Are you waking up restored? Are you having lymphatic drainage correctly? So I ask them that, but they're like, oh, I sleep like a baby. I take magnesium, melatonin, and progesterone. I'm like, I guess you do sleep great, but you feel like you're sleeping great. But I said, would you wake up? So for me, there's a peptide called Restore. That's a natural peptide. And it's 2 pills I take at night. I always thought I slept great. Mine's not a sleep problem. Mine is a wake up problem because I'm not doing any kind of lymphatic drainage at night. All my tabs are still open and they're still open when I wake up. So I wake up like, okay, blah, 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 and now I wake up and I'm like, okay, I dealt with everything. Everything's closed. My cortisol was able to lower and now it's raising. And I wake up without my alarm now. I'd have told you there's never going to be a day that I don't get snooze. But when it all levels off correctly, you can see how your body actually works for you and not against you. And so that's whenever there's a peptide that's made in the gut that is an injectable peptide. And it's also, it cures other things too, but it's really good for gut health. And there's a natural set of peptides that's good for inflammation, which is gut health and cortisol. Because I do feel like that progesterone layer starts to drop and that's where all the problems kind of start. But then it's not bad enough for them to really think anything, but it makes you feel like you feel fine, I think. And you can maybe speak to this. Like you feel like a little off, but not all the way off. But you can tell, you can tell that when you look at me like your cortisol stuff, like wazoo, what do you do for the day? And then they're like, probably like me, like I used to be. I work all day and then I go for a run and then maybe I'll go for a bike ride and I feel like it's clearing my brain, but my body never gets out of running from the tiger. It's running from a tiger 24/7. And so you just end up going the opposite of what you're trying to do. You're trying to lose weight and feel better. And you're actually getting bigger because your body's like, what tiger's coming next? And then I'm going to hold on to the food because I'm missing this meal. And
right. Hibernation.
Yeah. Isn't that like cortisone's kind of, its little playing field right there is how we displace it. And
I love to check cortisol throughout the day. Love it.
Okay.
Like morning, noon, afternoon, night. And if you wake up at night, another check.
I would love that.
Yes, I love that.
Right?
It gives us
just
a really good.
Is it just a oral swab? Yeah. Okay.
Yes. And you can do it through saliva testing as well, but it's just a great way to just observe like what's really going on in the body. Like how are we processing all of this? What's the normal day looking like? And also even going to the bathroom at night could be a hormone thing, right? It could be some imbalance as far as hormones.
In the middle of the night, that's a hormone issue?
It could be, depending on the person. It absolutely could be.
Okay.
So looking at hormones as far as that goes as well, like Are we having an imbalance that's creating this? I've seen several women, once we get their hormones balanced, they don't go to the bathroom as often. So I think that's huge. The other thing I see that's kind of, people don't really talk about as much, but hip pain. When hormones are balanced, we don't have as much hip pain with patients. I've even had a patient that her massage therapist saw the inflammation go down once her hormones were balanced. She's like, oh, you don't have as much inflammation in your hips. I mean, I think that's so great, right? But you have to look at like estrogen and what does it do for things like collagen, right? So as those levels start dropping, that collagen starts dropping too. So I always think of like the 10 man, like what does he look without collagen? Like we got to oil up, ladies. We got to make sure everything's working, because if not, things will, start to shut down. We don't work like we used to, kind of thing.
And most people know about collagen elastin. Most people after their 30s, and some now the younger ones are already doing Botox and they're already worried about looking old. They want to keep up with us, So, and after our 50s, a new 30 for sure. I feel 35 and I look 35, and I'd say I'm going to age backwards, and I'm going to, continue to try to feel good because I don't want to roll into my old age. I want to be young and be able to do the things that I want to do. I like to dance and move and all this stuff. And so I want other people to have that opportunity if that's what they want to do. But we just launched, Make Wellness just launched a new peptide with AI found a natural peptide that actually goes to the receptor, so our body will produce its own collagen. So, we're like collagen in your coffee, collagen with my protein, we all take in collagen, and that's helpful. But for our body to actually produce its own collagen again, like we were in our 20s, it's kind of what peptides do. And it's probably how hormones are. You want to just give it what it needs, what we had back in the day, what we had when we were in our 20s, that our body already made everything we needed. Unfortunately, as we age, it all just declines. And that's the normal progression to death. And we're not going to say we're going to live forever, but we want to live healthy and happy. But that normal decline, we can give our body messages with hormones, messages with peptides that will go to the receptor that says, hey, you've been by yourself for a while. Let me tell you that we can be friends again, and we can produce collagen. We can be friends again. We can do some, your hair growth, like there's different muscles. We can continue to make muscle, whereas before we wouldn't make muscle. We can give your estrogen, your hormones another balance again, instead of it being like, you're just stuck. Sorry, you're out of luck. And that's what it was for a while. So thankfully we have the ability now to test all these things and know how to, we're not really fixing them, but we're giving them the tools, and we're feeding their receptors, and we're trying to tell our body how to reboot and then how to repair on its own, so we don't have to just feed it medication. Because the medication, like we talked about earlier, it just does the opposite. It gives you like a short-term Band-Aid fix, but a lot of times it's not a cure-all, be-all. I mean, there are some people have to take insulin, people have to take thyroid. Like there are certain things you do have to take to function if your body has just truly shut down. But if we can catch it before the thyroid shut down, the heart's too much of an issue, our brain fog is so far that dementia and Alzheimer's is set in. If we can get to all these things before and just help our body heal on its own, I feel like that's a no-brainer, but I feel like a lot of people don't know about it. They don't even know that's an option.
I call it the ingredients, building the ingredients for the healing cake, right? Because everybody can relate of like, okay, if I get something and I'm making a cake, if I don't have all the ingredients, it's not going to rise.
Feel it.
That kind of thing. And so it sounds like to me, this new product that you guys have is like giving the body the ingredients to help it heal itself, right? Which is the whole idea when we look at functional medicine, root cause and that kind of thing. The most we can do that, the more we can do that, the better it is as far as really empowering the body to do its own thing, So I think that's great that you guys have that.
And I started talking about it, went off on Rogue. I said, but everybody's taking it like, oh gosh, my face, it's this, but it's internally. So you are building collagen everywhere. So we're going to build collagen in our hips, where our joints are going to be better. Our arthritis is going to go away or feel better. All the spots that we need, our body's held together by collagen. So it's like an elastin. That's how we get to move around all of our skin, everything, right? Like you could probably talk about this, like even more. To me, it's not just about the look of it, although that's going to be a great benefit along with it. It's going to help with cellulite, because that's when you lose all the elastin and, in your skin, and everything starts to get flabby. But also internally, it's going to help a lot to have more collagen and elastin in our body for function and for long-time longevity, right? Longevity.
That's the huge part. I did long-term care for 10 years. So, I mean, I saw it all, but What people don't realize is if you have a hip fracture, you fall and fracture that hip, unfortunately, within a year, that percentage of death goes up tremendously. Last time I checked, it was like 75%. And so, or specifically for women. And so we need to make sure that those things are intact. Those bones are working for us, right? So whether that's vitamin D or peptides or collagen, making sure that we have solid bones and our bones don't look like Swiss cheese, right? Because we want to make sure, I'm a big foodie. So, we want to make sure that our bones are solid, to where people, can be supported throughout their lifetime, and so that they're not just walking, but if they do have a fall, then they're able to kind of laugh it off. I had a client that I've been seeing for years, and she's in her late 60s, and she chuckled one day. She came in and she's like, Dr. Lynn, I fell out of a truck. And I was like, you did what? And she's like, yeah. She's like, but I just bounced. She said, my whole family was concerned about me and I just bounced. It was fine. She thought it was great, right? But when she first came to me, she thought she was going to need a cane soon because she was having mobility issues. So after working together, we got her in a plan where her vitamin D went up, her, not just her labs, but her, she was feeling better. She didn't have, issues with her knees or things like that anymore. And so when she did have that fall, her bones showed up. And so I just encourage women, like, we want strong bones. And then maybe in your 40s, you're not considering that as much. But let me tell you, you need those bones every single decade as you get older. So no, even though it may not be on your radar now, you definitely want to consider that.
Yeah. We're talking about older women, but I actually had this conversation yesterday about my 21-year-old son. My husband and I both were just athletes as we were young. When we were younger, I was gymnastics, dancing. Like I was always building muscle. I didn't realize I was banking it. Right. And so most people don't know they're banking it. So we have these couch potato kids now, I say, like, doing a lot of video games and not doing a lot of sports. And are they just like books? And that's fine. But I can see in my own life and my husband's life how now at 53 and 54, almost 54, 55, that the muscle we built was some of this is from when I was a kid. Like I didn't just rebuild all this muscle. And I don't think that I could build the body I have now if I wouldn't have laid the foundation when I was younger. And so even when you're in your 20s or 30s and you're using a GLP-1, or let's just use that as an example, and you're just skinny fat, you have no muscle because the GLP-1 is eating all your muscle up, but you're skinny and you look great. And that's what we all wanted as college students and 20-year-olds and getting married. And we all want this great body. But then what does it do for us? How does it sustain us when there's not a single ounce of lean muscle tissue left in that body, much less, a large group muscle that's going to do something for you? So I think that even though my demographic for who I can relate to more and treat, I do see that now where I'm telling my 21-year-old, my 24-year-old, 25-year-old is a personal trainer. So he has his whole life over.
Check that box.
He's checked it, way over-checked it, but he looks amazing. Him and his wife both. But the 21-year-old is a worker. He's a missionary. He goes on a mission field. He doesn't sit still and he's not fat, but he is never truly besides football when he was in high school, but they don't do a whole lot of it, as truly start to build this bank of muscle. And so we were just talking about that, it's important starting in your 20s to go to the gym, it's weight training, right? It's like adding that muscle underneath, wherever you want to add it underneath or on top. It's not going to make you, as a guy, they don't care if they get bulky. It's not going to make a girl bulky, but it's going to give us the foundation that we need for sure to live. And they won't have to have so much of this conversation after. They'll have some of this conversation when they get to our age, but not the muscle part. They'll have some bank. So I do like that because it is going to start going away. It starts eating away at our muscle as we start going into menopause and perimenopause.
But a lot of people now on GLP-1s are having that same challenge, right? They're losing a lot of muscle. And so they're finding that they're having atrophy, I had a marathon runner that came to me that she was on GLP-1s for just a few months, and just the amount of atrophy that she had was outstanding. It was like crazy. And she's like, how do I fix this? But it really messed up kind of her overall immune system too. And so it's
this much. It's like, there's a lot of things. There's a lot of good with this drug that can be used for good. But then it has to be added. And that's kind of where my pairing system is. I started, and we haven't really talked about it, but the peptide pairing, my powerhouse peptide pairing method. It's kind of what I really felt like that was needed. It's kind of like our pairing. It's so needed. It's like you have to make everything balance and be correct. Whereas if they want to take a GLP-1 and they truly need it, then we've got to give them something that will preserve their muscle. And the doctors are just throwing this other synthetic peptide at them, which doesn't really do a whole lot. Or they're trying to go towards retatrutide because they feel like, retatrutide's better GLP-1 because it preserves muscle. You're still losing muscle. And if you're our age, we're double dipping now. We're like making it worse if you're doing it at 40 and 50, trying to take a GLP-1. So I know my make products have, and you know them because you're with them, but this company's come up with some amazing natural peptides that preserve lean muscle. And the science proves it. It is proven that if you did, which we don't tell you to do, sit down for a few months, or if, maybe you're sick or you're in the hospital. We've had, older men that have had just recently had some knee replacements and showed that they took their fit. Their healing was better. You're building collagen. You're building lean muscle. You're keeping the things that you would normally just tank. Like it would just go away so quickly.
One thing too, Aimee, I don't know if you can kind of speak on if people are coming from the injectable mode into more the peptides that you actually sell. Can you kind of tell them as far as the usability of it, as far as the ease, can you speak to that as well? Because I think a lot of people don't realize how peptides can be easier than they think.
Yeah, it used to be, if you talk to old gym rats, like people probably our age that were in the gym, they were doing some peptides before, which is growth hormone increasing, because that's what's going to build muscle faster is if you increase your growth hormone, which we do at night when we sleep, if we sleep correctly. Or you add it in as a synthetic issue. And that's kind of what they started with back in the day. Of course, insulin was our very first peptide, at which that's been amazing. But that's a peptide, the very first one. But they all think about it as injectables, and it's known in the gym world that you can't ingest a peptide because it doesn't make it through the gut. And back in the day, it didn't. And there's still some that are out there right now that are not made correctly that cannot withstand the gut. So the acid in the gut will just eat it up. So you're paying for the peptide, trying to take the peptide, and you're not getting the benefit. So then they think you have to inject. So that's what most people know about. They know about the injectable GLP-1s, injectable insulin. There is a few other people that are kind of dabbling, and I give out some of the other peptides as well that are injectable on occasion for certain situations, and they go to their receptor. But I've found a company that with AI has found a way to not bypass the gut, but coat the peptide in a way that it goes to the receptor even through the gut. And so it's it's all natural, it's all found in nature. God's already made it. We already have the peptides in our system. We already had them. So we have the receptors waiting for the text message. We have the receptor, that's the text message, is the peptide. Our body's still waiting for this because it used to just get the message. Okay, lose the weight. Don't eat so much, get better sleep. All those things used to just go right in. Well, now we've lost the receptors. And so we give it the receptors again that God's already made it in nature. They find it, they package it correctly, wrap it around some amino acids so the amino acid coating can go into the gut and ship out their receptors to get to the messengers to get to their receptors the correct way. And so it does produce the things that we can do. So you can have a peptide that can go through the gut. You can have a peptide that is delicious because it comes in packets. Most of them come in packets where you put it in water and you kind of drink it during the workout, pre-workout. There's an energy as a clean energy, which is amazing. I'm trying to get that in front of more teenage kids, that in the hydrated. There's a muscle stack now that has the fit, which means that it's going to make you fit, right? So that's the one that's going to add muscle. And muscle synthesis, protein synthesis. It has precursor to DNA, NAD. I'm just like the moment right now. So it has all these great things in it, and it's great to help kids increase their muscle mass without taking a synthetic peptide, which they can't take a synthetic peptide. God forbid. I hope nobody's giving them a synthetic peptide, but there is black market out there. So we got to be careful what our kids are trying to get a hold of, because they hear these adults talking about peptides and they see these adults getting muscular or whatever, and they want to have that. Totally not good for their body. But this one is just a liquid. And so or it will be a liquid. So you put it in powder form. There's 3 that are pill form. And the company says only because they couldn't get them to taste good. They had to put them in a capsule, which I'm like,
okay. That makes sense. I get it.
I'll take the capsule all day long if I need to. But the ones that are powder are delicious. And so they have the clean energy, which is amazing. It's made with a little bit of caffeine, but not much. And then it's all clean. All of them have no sugar. You can take them as fasting. You can take them before you do fasting blood work. My husband actually, we do one every morning. We call it the Mounger Wake Up Pill or the Mounger Wake Up Drink. And it's an energized and a hydrated together. And it truly increases your dopamine and your serotonin. It's proven, it's in the science. And so you take that and make you happy. Well, he drank his, of course, and he goes to get his blood work, which was supposed to be fasting blood work. And he's like, oh, I wonder if it's going to show up. His blood work at 54 showed up like he was a 30-year-old man. And nothing ever shows up because it's completely clean. So that's a really great benefit for people who can't have sugar, don't want sugar, if they're methylated. Like there's so many things that people are like, oh, I can't because of this, can't because of this. One of them is grapefruit flavor, but it doesn't affect people that can't have grapefruit because of medications too. So I love these products. And so I try to get them, kind of like you, I try to get them to people to benefit and start adding the good back into their system. And at some point, getting rid of some of that medication.
And also the hydrate you mentioned, and I don't know about you, but I'm seeing more and more clients that are coming in with a 99 temp because it is so hot out there.
Yes. So, hydration
it's nice for hydration, but what a lot of people don't realize about electrolytes is although, the 5G towers kind of help us with our external cell phones, we have inner cell phones too. And so if we want that cell to cell communication happening and we don't want to sound like the Verizon commercial, we need electrolytes, right? We need
all of your analogies. You should write a book of analogies. You're so good. I'm like,
yeah, we got to get everything talking, right? So whether you're doing peptides or you're supporting it through nutrition, like if nobody's talking, we got a problem, right? We need that electricity. So I love that you add the hydrate. I think that's great.
Yeah, no, you like that one too. Yeah, there's some really great ones. There's so many good benefits to finding somebody like you or I that can just kind of talk them through it. And if nothing else, just talk through it. If you can't do anything about it, like God forbid, but at least it's out there. And that's kind of what I'm trying to do with my podcast too, is like explain to people that it's out there because a lot of people just don't know. Like they haven't found you yet. They haven't found me yet. They haven't, or they've heard about peptides, don't understand it. They know about hormones, but they're like, oh, I don't want to take anything. I hear that from ladies, like, I don't want to take anything. That was me for a while too. I was like, I don't think I want to take a hormone. Like, I don't think I want to add anything synthetic into my body. But you have ways to treat them with bioidentical hormones, right?
Yes, absolutely. Absolutely. And some of that fear came from some of the studies done in 2000 and different things like that were really not completely all scientific studies, and some rogue information was passed around. So know that there has been misinformation on hormones before, that I really encourage our listeners to find someone that knows what they're doing with hormones and somebody that was going to specifically build your own recipe. And everybody's going to really need a different recipe. So build your own recipe, which I know, Dr. Aimee, you meet people where they are. You do a great job with that too. And somebody that cares, there's a lot of people that just are, out there. But I mean, finding somebody that truly cares about you and wants you to do well, I think is also a huge component of health.
Yeah, definitely. Yeah. We thrive on seeing the results of somebody getting better, feeling better. It's like, that's what makes us happy. If you can do it for free, do it for free. That's see us all, thrive and survive, and not just survive, but thrive is ideal. I do want to mention too that, there is lifestyle stuff in there. We've kind of hit on lifestyle stuff a lot in there, but, building the muscle, doing all the things like, mentally, spiritually, whatever that looks like, we can pray with you. We can help you find that kind of way to do it as well. Like to get it off of us is a big deal, right? Like there is, yes, our body is the vessel and we have to take care of it. And there's ways that you can come to us to balance certain things and make you feel better. But there's also that component where we can do all we can. But if your body is still in that mode, there's something internally, like your heart posture is just not right. And you're still holding unforgiveness and holding all these things. If you've never heard about that, you don't even know that that's a thing. Like, you don't know. I didn't always know that either, that affects your cortisol hormones, your peptide receptors. It affects everything. And then our mood and all the things that we're trying to fix. So we can throw as much stuff at you as you can. But sometimes it takes talking to somebody who really cares, who can figure out, I hear something else. Like my girl yesterday, I was like, I hear something else. You're stressed, right? You're stressed. But where's this other stress? Where's this stress coming from? And so we were able to kind of pull that out a little bit. So sometimes it gets kind of deep. Don't you feel like it's
oh, absolutely.
Degree.
Yeah, absolutely. For some people, they are walking basically with another wall up, right? Because they feel unsafe. And sometimes that other wall can present itself in weight gain, right? It's that shield. Until I'm safe, I'm not coming down with my shield.
There you go.
Right. And so it's just one of those things where we have to help people like feel safer and get empowered and feel like they can live in their own bodies. And looks different for everybody. Everybody's going to need a different component of body, mind, spirit, emotion, emotional health as far as that goes. But we really do have to include the whole body, not just the physical body, because a lot of times that's the last bus stop, right? Everything else usually comes before that. So we want to make sure it's all together and we check all those boxes.
Yeah, I do love that. I do want to tell you too, because I don't think you know yet, but there is an AI trainer that Make Wellness has now for people. And so people, sometimes when they are trying to fix their hormones, it can get expensive because insurance doesn't cover it. When they're trying to do some peptides, it can get expensive. But I do have a way for, and we do blood work for you. Both of you and I both will do blood work. I probably would push most people to you to do the blood work. But I can do it too if I needed to have a company. But getting those labs, getting the blood work done, getting the base foundation. But then at some point, we're going to need to do that training we talked about and the nutrition training. You touch on some of that with your people, but then there's an app that they've created. And it's a free app when you use the Make Wellness products. And it's amazing. It has like nutrition and, it's ChatGPT. So it's your AI best friend. So it's like your personal trainer. You can call at midnight and be like, I really want a chocolate bar right now. And it talks back and says, well, you have had too many carbs today. Or it'll say, actually, you know what? Take a piece of chocolate because your macros or, you haven't met your macro, whatever it is. So it's pretty amazing. Not pretty amazing. It's amazing. And it's a great tool to add to their toolbox whenever they can't afford a personal trainer. Because as my son being a personal trainer, and I've gone to personal trainers my whole life, I do think that personal is the same as us. It's a one-on-one. So that is a benefit but not everybody can always get that benefit.
It's good to have options, especially if that means in your back pocket.
Yes. And that phone is always in their back pocket. Or in their hand. Even my parents are like that. But we do have those tools too. So I feel like you and I, between the two of us, we have lots of tools that we can help people with. And I love that we can bring the medical foundation of what you're doing alongside with a little bit of the peptide world that people are just kind of getting to know. Along just overall health. It's like we want to do the hormones, the peptides, the lifestyle, spiritual, add all that together to just be a holistic practice of helping just one patient at a time. I know you don't have people lined up to where you're like, all right, I'm done with you. You are very cautious and conscious about your time with your patients. You take the time to study them even before you meet them, which that is just amazing. And it's not something everybody does. It's a blessing. Any patient who can have a piece of you. I mean, your brain, you blow my mind every time I talk to you. You have got so much information. And of course, I love your analogies. You help
I wanted to also tell you this, Dr. Aimee. So for your listeners today, I want to offer a $25 off coupon for their initial visit. So till October 30th, if you mention Dr. Aimee when you book, then we will give you $25 off your initial visit with us to help you start your journey. Because I know everybody's in a different space. So we really want to be able to support you and empower you on your journey, because I think that's super, super important.
Yes. I love that. Thank you so much. That's exciting for people. I can't wait to hear some of the success stories that come out of this. And I hope we can spread this. So if anybody's listening and you want to send it to mom, sister, aunt, cousin, sister-in-law, mother-in-law, all the things, and make sure we get these women the information that they need. And in the bottom of the podcast, even though it's not the traditional podcast that we're doing this way, but I know JourneyWell will put your contact information in there and how they can get in touch with you. And that way you can reach out. And on social media as well. So social media. Hold on.
American Center BR. Yep.
Okay. Awesome. Well, I thank you so much. It has been so amazing. We'll have to have you back, like we said, and talk about the men. I guess we'll let them in.
Absolutely. Thanks so much for having me, Dr. Aimee. This has been a blast, but we'll definitely continue with some of our other topics, because I know we can make this an all-day episode if we wanted to.
You and I can definitely talk all day. For sure. All right. You are the best. Thank you so much.
All right. Thanks so much for having me. Take care.